them on all that carry. At some point, you even try to lose track of where some of them are located. But at this point, the government has enough machinery on ground to monitor even the 1 million. That is why we have the Ministry of Works and various other ministries. So if it's in your own ministry, rural development, you should be able to give the government an accurate report. But in this case, I think the government needs an independent monitoring team that will give him an on-the-spot report of what is happening. There are so many things that needs to either be cut down or be improved upon. Thank you.
Okay, I go back to Dr. Basri. Obviously, while you try to identify one issue from that speech, and you can say, oh, for me, this is it. Now, you can also add to the question I asked Clinton, which of course, virtually all the analysts will look at. Do you see an overload in the projects? And do you think they can meet up with the time?
First, okay, let me start. One area I think is very critical. For me, I'm a health person, a health professional.
I was expecting that.
And I'm a public health expert. One area that's critical to us is the level of care. Anywhere in the world, we know that nearness and proximity to hospital actually facilitate service care, and it actually reduces costs to financial burden to the patients. So when you said 260 school facilities, I was excited, not because it's new, but I was excited that it's a renewed ideology, a renewed hope. If I should borrow the word renewed hope, of bringing healthcare facilities closer to the people. But I looked at it again from the perspective that these underserved areas, people that do not have access to quality healthcare, people in the rural areas will now be, have the opportunities, to be served. I equally understand. I work in Parkland, and I understand what it takes to upgrade the secondary healthcare facilities. Across the state, you have about 7 of them, which is former General Hospitals. What are the tertiary, secondary care services supposed to render? They're supposed to render, a much more sophisticated healthcare services. So if you have a good referral mechanism, what we call two-way referral mechanism, whereby the catchment area of these secondary care facilities are within the rural areas, it simply implies that you reduce the cost burden coming to the state-centric healthcare facility. At the tertiary level, we are already having both UNTH and Parkland, almost working out themselves. For so many of us who have been privileged to go to UNTH or Parkland these days, they will tell you there are no best spaces. So that is the commonest thing the patient would understand. There are no best spaces, and the workers are being over-labored. So it simply implies that if you have these good, efficient hospitals, there's no reason why somebody who had just road traffic accident in Abani lacerated should be coming to Parkland. Should have actually ended up at Abani. Now, the other angle, which is very wonderful, is taking a look at the quaternary care. And we understand that healthcare is what we call equity and equality. What it simply means is that people bring in fund. If a poor person comes in with disease, the person that is poor should be able to access equal care with a person that is so rich. For example, if you're having malaria and then you don't have more than 1,000 naira to get treated, we should be giving a health, drug that should be able to take care of the person. So in equity, we now begin to look at those that are coming for medical tourism, like those that would have gone to India, for medical tourism, instead of paying just 2,000 naira or 3,000 naira for the healthcare services rather than for malaria, they can pay as much as 30,000 naira. Now that becomes a tourism mechanism, which is where I am looking at the blending he is trying to do. And India already is practicing similar, similar health policy. Where you come to a hospital, you have like two sets of human beings. One area is 5-star hotel, the other area is meant for general hospital. Now you'll be treated equally, but you pay differently. So that actually takes care of the poor, and then the rich. It's a sort of equity distribution. So I feel that's where he said it to. But there's a pitfall, which is where now brings me to the point where you talked. When you talk about the building blocks of healthcare. You see that infrastructure is one, but human resource is a very critical point. Human resource is an issue that has bedeviled Nigerian health sector. I don't think there's any country in Africa today that brings, that produces healthcare staff like Nigeria. If I tell you that in Nigeria per annum, you get not less than 20 to 30,000 nurses out per annum. But we are a day. Almost all of them are traveling, are Japan. So now the whole bag I'm having is how do we sustain them, and that is where I think is a very big challenge. The idea of having even the healthcare facilities, staff quarters there is very good, but more importantly, what are those things that are chasing them away from staying in the places? I know that Enugu State Ministry of Health through State Primary Care Development Agency recently recruited a whole lot of health workers. But the big question we're going to be asking ourselves, one, how many of these health workers actually domicile in those areas where they are recruited? How many of them will be retained after a given point in time? And I believe this is where the local government chairman should be able to come in, to see what they can do. So as we go on, we can reiterate some of the things they may be able to do. Then, there's another big plus, and I will still say a negative to it, which if it's not well sustained. The issue of data. You see, the hospitals are going to be smarter from what he is trying to say. You have your records that are automated, records that I can be in Parkland, and if I punch, I'll be able to have assistance. For me, that is a key. When you want to transfer knowledge, when you want to do telemedicine, you do it within the environment where you are. Let me give a typical example. If there's a way to get all the health doctors, to begin to queue into the training done at Parkland, it might not be you coming to be a resident doctor. But assuming, let's do, for example, pediatrics. We're going to be discussing about malaria today. And the doctors in the periphery should be able to join pediatrics department in the better management of malaria. Or if they have a case, they can easily communicate with other persons and then have a proper solution to it. I think that is where that electronic and ICT should be able to be operationalized and optimized. It will in the first instance, it might be expensive, but it's going to drive the cost of healthcare services down. It's going to bring efficiency in the management of healthcare patients, and it's going to help in transferring knowledge from the city center now to the periphery. It's going to help in retaining the health workers better off there, and it's going to bring people to entrust the health system much more better off. So I think I will let me round up.
Okay, gentlemen, I think we should take a short break, but I'm going to give an expo. Because this question